There was a moment where I was done. And I thought about taking all of my oxycodones, to be honest. I didn't do that. I told my husband immediately because I got scared. I was like, oh my God, I almost just took all of these pills. And so he hid them from me. Hi, I am Lauren. I am from Ohio, and I was diagnosed with acute lymphoblastic leukemia in May of 2022. I felt like cancer was the hardest thing I've ever been through in my entire life, the biggest challenge I've ever been through, but also, as now that I'm on the other side of it, it was a blessing in my life. Which sounds bizarre, but but like reflecting back on just how challenging it was and how it tested me, it's been a blessing because I have become closer to God throughout this journey. It all started with what I thought was a cold that I had. The cold was just like a normal cold. And then it kind of got worse and worse and worse, where I was having really bad, like croupy kind of coughs very frequently. It got to a point where I started spiking a fever. So then I was like, okay, this is probably not a cold anymore. I thought maybe I had COVID, something like that. So I contacted my primary care doctor because I was actually going on a business trip to Florida in like a few days once I got sick. And I was like, oh my gosh, I don't want to cancel this. So I called my primary care to see what he could do. And so he had me come in, he checked me, and he's like, oh, I think you have bronchitis. So we'll have you do a Z-Pack and then some other pills. I don't remember what he gave me. And then I ended up going to Florida for this business trip. I felt awful the entire trip. It was very, very difficult to sleep and just be present when I was there. So when I was on my way home, the coughing was so bad. My chest was killing me. I called my doctor and I was like, it's getting worse. So the medicine you gave me did not help. So he ended up giving me steroids, like one of those 6-pack of steroids. So I started taking that, and I felt better after taking the steroids. I was like, okay, my cough's gone. I'm not like dying, like can't sleep, all that stuff. But what happened was the second I came off the steroids, everything came back. My chest was hurting again. The cough was even worse. I was unable to lay flat, so I had to sleep in my recliner chair because if I laid flat, I couldn't breathe. And then I was like gurgling things up. Like it felt like a lot of liquid or fluid. So I called him again, and he's like, you need to go get a chest x-ray immediately. So I went to get a chest x-ray, and I remember taking my oldest son at the time with me. And I was like, everything's going to be fine. He's like, you might just have like pneumonia, and we need to figure that out. So I get the chest x-ray. I don't think anything of it. Then I get a call from my primary care doctor, and he said, we got your results back and they're abnormal. And I'm like, okay, I didn't know what that meant. I thought, okay, maybe it's pneumonia. He's like, I need you to go get a CT scan like immediately. And when he said that, my heart like sank. I was like, okay, something's wrong. And so I called my husband, who was golfing with his friend at the time. And I was like, my chest x-ray is abnormal, so I have to go get a CT scan. And he's like, oh, it's probably fine. It's probably nothing. So I go get the CT scan by myself, which was a huge mistake. I should have had somebody with me, but I went by myself thinking, okay, it's fine. Was not fine, because the second the nurse called me back to get the CT scan, I lost it. I was hysterically crying, hyperventilating. And she's like, it's okay. it's probably nothing. We have to see what the results are. I was like, I know something's wrong. Something's wrong. Something's wrong. I know something's wrong. She's like, it's probably okay. And whatever. She's trying to comfort me, but that didn't help. So I get this CT scan, and like an hour later, my primary care doctor calls me and was like, you have an enormous mass in your chest. They're like, we can't do a normal biopsy like with the needle biopsy because we don't think we're going to get enough of it. I'm like, okay. And and it's like behind it's like, I can't remember if it was in front of my heart or behind it, but it was leaning on my heart in some way, shape, or form. So like, we can't remove it because of where it is. So we're going to have to do, it was a really long name. I don't remember it now. It's like sort of with an M, where I have a scar on my neck right here. They had to put me under, they had to cut my throat and then put something down and grab a chunk of the mass to be able to do a biopsy on that. So they're like, you have to wait 5 to 7 days to find out what this is. And I was like, what? That is so long. I cannot sit here and wait for 5 to 7 days. So they ended up putting me up in the ICU because my sister got me up there. And I remember getting out of my biopsy where they put me under, and I just remember screaming, I shouldn't be here. I shouldn't be here. I'm a healthy person. I don't know why I'm here. And my husband said like the whole room was just bawling their eyes out because I was still kind of out of it from the anesthesia. Finally, the oncologist comes in, and he had a really interesting demeanor. He was an amazing doctor, very smart, but didn't really have like bedside manner, I guess. So he comes in, doesn't even say like, hi, how are you doing? I'm like shaking, crying. He just goes, you have T-cell Acute Lymphoblastic Leukemia. Any questions? And I was like, what did you just say? I don't even know what you just said. Like that didn't sound like English to me. And what really upset me was my sister when she was like speechless, like, what? And so she started asking him, I don't even know what she was asking him, but he's like, yeah, this is going to be an inpatient, something about how I was going to have to be inpatient. First off, I didn't know what inpatient meant. I've never heard these words. I've never been in the hospital other than like breaking stuff when I was younger. So I have no freaking clue what he's talking about. And Miranda's like, my sister's named Miranda. She's like, that means you're going to be staying in the hospital. I go back home and I remember watching Curb Your Enthusiasm, trying to like be happy in some way, shape, or form, or laugh, but I was numb. I just was staring. I couldn't communicate. I couldn't do anything. And I think it was Sunday. I was laying in my chair and my entire left side of my body went numb and I freaked out. So my husband calls Cleveland Clinic, speaks to a fellow, and they're like, you need to come into the emergency room right now. So I go to the Cleveland Clinic emergency room. They admit me very quickly. So then from there, they're like, okay, we have to drain the fluid off of your heart because the mass is creating so much fluid that it could collapse your heart valves and you will die. So we have to immediately go to get that off. That was horrible. I was wide awake for the whole procedure. They took off like 16 ounces of fluid and they showed it to me. And it looked like yellow Powerade is what it looked like. It was crazy color. But I felt so much better once they took all that fluid off my heart. I could finally lay flat. And this is where they started. The reason they keep you, anybody who gets diagnosed with leukemia has to be admitted for a 30-day stay right away, because the chemo that they give you is extremely strong and dangerous. And so they want to make sure your body can handle it. And if they can't, that they're there to, if anything goes wrong. I actually was, at this point, they gave me like a calendar of like my treatments and like what days I'm going to be doing what and all of that. And I finally like felt a sense of relief in a crazy way. I'm like, okay, we know what it is. Now I have a plan of how they're going to get rid of this. They did a bone marrow biopsy. They did not find any trace of disease in my bone marrow, which was great because my sister and my brother sent in, I think, like some of the, like the swab to see if they were a match, and they weren't. So that was kind of scary. But then they told me there's no disease. You're not going to need a bone marrow transplant. And it was kind of weird because also they didn't find it in my blood either. And leukemia is a blood cancer. So they said I had more so of a lymphatic cancer than a blood cancer, but I still had leukemia. The hardest part was saying good, because nobody was allowed to stay the night with me. At the beginning, my treatments were kind of spaced out more. So like if I looked at the calendar versus later calendars, it doesn't seem like a lot, but they were very potent and strong. So at that point, I got chemo every single week. For about 10 months, I had chemo every single week. Sometimes I would have chemo twice a week, depending on the schedule that they had. So a lot of it was, I had a port. So a lot of it was chemo placed into my port. I would go sit in the chemo room and watch TV and whatever, and they would do the port chemo. And then I also had a different chemo. It was called an LP, or a lumbar puncture. So what this was like an actual procedure that I had to go to the actual hospital for, not like the chemo room. And that procedure, basically what they did was they would take a needle and put it into my spine, and they would administer chemo through my spine. And when they would do that, at first it was absolutely torture. It was horrible just because, like, they have to put the lidocaine, which is not a fun thing. And then they would put the needle in. They would have to find the spot to put the needle in, and then they would administer the chemo. And then what I would have to do is roll over, and then I'd have to lay in a recovery room for an hour flat. I had to be completely flat because the chemo, they want to go up into your brain, because apparently the type of cancer I had can come back in the brain. So they do that. So I had total 26 lumbar punctures, because I asked them on my last one, I'm like, how many of these have I had? Have I had like 50? Because it felt like it. They're like, no, you've had 26. I don't really know how many port chemos I had. But if we do math, like once a week at least for 10 months, that's basically how much port chemo I had. I lost my hair during those 10 months. Like when I would brush it, it would just be like clumps. To take showers, I would have clumps. So I actually did like a head shaving ceremony with some of my friends, my family, and like everybody brought flowers, and we played like nice music, and we set intentions, and tried to make the best of it. And my husband shaved my head. was. And then they did offer, this was kind of like my choice for brain radiation, because they said it's more of like a precaution because they don't want it to come back into the brain. So I said, you know what, whatever, I will do it. I want to kill anything that could possibly be in different places. So I did 12 rounds of brain radiation, and that wasn't actually that bad. But that took my hair completely bald, like nothing. And after all that, I entered into what's called the maintenance chemo. So maintenance is supposed to be like 2 years long. So what they do is you have 2 different chemos that you get in your port. And then you also still have lumbar punctures as well. But it's not as intense, at least the port chemos aren't. And then I also had to take a lot of chemo pills. So they kind of put me on a lot of chemo pills. And then some like antiviral pills and like trying to keep pneumonia away pills, those kind of things. And then, oh, I forgot, steroids. You're basically when you're in the hospital for that 30-day stay, you're taking steroids every single day. You're taking 100 milligrams every single day. So my face blew up like moon face, enormous. I didn't even recognize myself. I still have the neuropathy right now that I'm dealing with. But I ended up, one thing, like the biggest piece of advice that I would give somebody going through all this is get a palliative medicine doctor. Because the symptoms, I was extremely nauseous. Only threw up like a couple times, but the nausea was awful. Extremely fatigued, depressed, like because of the steroids, those cause anxiety and depression. And so I was experiencing that. I had extremely bad leg pain, like achy, like super achy, and it wouldn't go away. So my oncologist kept saying, you should probably get a palliative medicine doctor, like through the Cleveland Clinic. And I was like, isn't a palliative medicine doctor for like hospice people? Like, what do you mean? She's like, they will help you manage your symptoms. That is their job. I also had a little tiny mass in my collarbone that they found with the PET scan. And then I had a mass in my breast as well. They did do a biopsy for the breast. I was like, can you have 2 cancers at once? And they're like, yeah, you can. I'm like, oh my God. So they did a biopsy on my breast. Thankfully, it was just related to the lymphoma. So yeah, when I got my PET scan, everything was gone. So they considered me in remission early on. And then they kept checking me. I'm still in remission right now. My doctor has never used the word or the ND word. She's never said that. She just would say, like, you're in remission. It's not there. It looks good. Everything looks good. So I'm guessing that's her way of saying that. Yeah, so today, still in remission. Everything looks good. She said, I can get CAT scans if I feel like I need one. Because she doesn't want me to be exposed to radiation if I don't need to be exposed to radiation. I used to not like drink heavily, but, I would have drinks a lot with my friends and we camped and all of that kind of stuff. I do not drink alcohol and I don't know if I ever will ever again. because alcohol is, especially if you've had cancer, can really like raise the risk of you having a relapse. So I definitely I don't think I'm going to do that. As of right now, I feel very comfortable not having any alcohol. Before cancer, I had a business with somebody, and it was like a health and wellness where we worked with people on their mindset and routines and meal plans and all of that. The business kind of started turning, my business partner was it was turning more into like a spiritual thing. I don't know how to explain it, but it really felt like wrong to me, the way that we were doing it, and I wasn't interested anymore. But then when I got diagnosed with cancer, I thought I could keep running our business, but that I couldn't do it. I couldn't get on calls. I couldn't do anything because I was so tired or sick or nauseous. So I ended up leaving the business, and I was devastated because I thought, I put all this hard work into this. This is what I thought was going to be my career forever. But as I went through cancer, I was like, that was not meant for me. Like that was not the path that God wanted me to be on. And I'm also not pushing my body to the extreme like I used to, because I used to have like an eating disorder and I would over exercise and all of that. And I feel like I'm accepting my body a lot more because cancer really changes your body. You can get through this. You're not always going to have the mindset that you're going to get through it. So I'm not going to sit here and say, just have the mindset that you're going to get through it and you're going to get through it. Because there's going to be times where you're going to want to quit and you're going to say, this is too much and I can't handle this. But every single day that you go through chemo or radiation or whatever it is, and you wake up the next day, you conquered that day before, and you can do it again the next day. Think of your treatment one day at a time. Try not to think, well, what's down the road? How many more of these do I have? I know that's going to creep in for sure, but be as present as you can in that day. And especially on the days that you have a little bit of energy. You're going to have those days. You're going to have days where you have energy, and you're going to have days where you feel happy. Hold on to those days because you're going to have a lot of really hard days. But I would just say one day at a time. You're going to get through it. You'll get through it. And if you feel lonely, reach out. Especially to talk to your doctor about it, because they have so many people that can help you no matter what you need help with.